to join. Um, so I wish I could get my notifications, but we'll do it again another time. Because I
Yeah.
get text messages and it's so distracting. That's okay. Don't worry about
Okay.
it. Yeah, we'll do it later. Anyway, hmm, goodness, what a crazy time. I don't know how you're doing it, Senator. I want to talk to you about that in a moment. But as we get people joining our conversation, thank you all so much for your interest in this topic. This is something I care deeply about. We're going to be talking about cancer research, cuts to the NIH, the impact this is having on research universities all over the country. I am very concerned about these cuts to NIH, the impact it will have on the progress, incredible progress we're making. And this is such a inflection point for cancer research because of technology and basic biology and all sorts of factors kind of coming together. So I'm excited to be talking to Dr. Jamie Bernard of Michigan State University. She's been talking about this, how these cuts are impacting her breast cancer research, and I'm really thrilled to meet for the first time,
Yeah.
which seems really surprising to me, Michigan Senator Elissa Slotkin, who is also concerned about the global. I mean, she's concerned about what's happening in this country, obviously, but the global ramifications of these cuts because of the brain drain that is happening with many young scientists leaving the country because their research simply isn't being funded. So I'm excited to have them both here, also really excited to have you all. There's a nurse that just joined us. Nurses rock, nurses rule the world, in my opinion. But for you all to share your concerns and questions that you might have for both Dr. Bernard and Senator Slotkin, but for me as well, because I do feel like I actually have some expertise in this area. And I apologize for my voice. I've been fighting a cold. But Dr. Bernard, let me start with you. You're a breast cancer research at Michigan State University. I'm curious because I know you were initially studying melanoma, but what inspired you to move into this space in particular?
In 2016, my mother was diagnosed with breast cancer. And we've really made some great strides in breast cancer research with earlier detection strategies, more therapeutic options. It used to be this was a fatal diagnosis and families couldn't afford it. But now, with these more therapeutic options, we're doing much better. But there are some types of very aggressive breast cancers that we cannot cure, and also some subtypes that become resistant to therapies. And those are the exact types of cancers that I'm studying in the laboratory right now.
So it's interesting because I was diagnosed myself, shockingly, in 2022 with breast cancer, with hormone receptor positive breast cancer. I got a lumpectomy and radiation. It was stage 1A, I believe. I should know this. My oncotype was low enough that I didn't have to get chemotherapy. But honestly, the whole time I was being treated, I was both grateful for science that I was able to, to handle this disease, but also grateful to the access I had. And we're going to talk about access and sort of health equity in a moment. But I remember thinking, gosh, what do women do who don't have the quality of health care I have? And it made me feel terrible, to be honest with you. So, um, I know what you mean about making progress if it's detected early, but of course, then you have the access to early detection through breast radiologists, et cetera. So, anyway, we'll talk about that more in a minute. But Senator Slotkin, I know that this is also personal for you. Your mom died of ovarian cancer in 2011. She had had breast cancer in her 30s. Tell me about watching your mom's experience and how it impacted you, not only personally, but how it inspired you to go into politics in many ways.
Yeah. I mean, I think It's exactly what you were talking about. My mom was a 30-year survivor of breast cancer. And later in life, after my parents divorced, she, unbeknownst to my brother and I, struggled to afford health insurance. She had a pre existing condition. She had that breast cancer on her files. And so the insurance that was on offer to her was too expensive. And she ended up going 6.5 years with no insurance. So a woman who had already had breast cancer at 31 was getting no regular checkups, no gynecological exams, no one saying to you, get genetic testing. You should think about a hysterectomy early, like all the preventive care that happens. She went 6.5 years without. My brother and I figured this out. We found out about this. We helped her get insurance. Um, she let it lapse. She paid another bill and let her insurance lapse, and then walked into an ER at Henry Ford Hospital in Michigan and was diagnosed with stage 4 ovarian cancer. And, I think everyone understands that first time a parent or a loved one gets sick and you're like thrust into the medical world for the first time and that's not your background. That's already so much. But, the same week and the same month that we were trying to get her emergency tests and get her scheduled for emergency surgery was the same week and the same month that we were filling out paperwork for her to declare bankruptcy. Right. And so, I'm a former CIA officer. I've done 3 tours in Iraq. I've done lots of things that were hard. Nothing was harder than dealing with a terminal diagnosis of the person I loved more than anyone when they didn't have insurance, and that desperation that you feel, which for me was a huge reason why I ran for office the first time. I didn't know anything about running for office, but they were threatening Obamacare, which was the way that you got insurance if you happened to have a pre-existing condition. They couldn't gouge you anymore. They couldn't overcharge you. So for me, this is a very personal story. I'm thrilled that you're talking about it and talking about it and advocating over all these years, because it's sometimes a very quiet story that somehow we all go through.
We should have even a separate conversation at some point, Senator, about healthcare in this country and the disparities and the cost and the caste system that exists between people who can afford insurance, people who can't. I know Obamacare helped, but there's still
Oh,
so many issues with healthcare in this country and insurance companies. But we're really here today to talk about cancer research funding. But I would love to talk to you, and it's so complicated. So I need to educate myself more. I know Zeke Emanuel wrote a small book about healthcare that I've been meaning to read, but I haven't done that yet. But let's get back to this cancer research funding because Dr. Bernard, the NIH budget provides, I think people don't even understand how it works. The NIH budget provides more than $35 billion a year to research groups, universities, hospitals, scientists. Um, can you explain how that works and how they go to both direct and indirect costs? Because I think for us to figure out a solution to this problem, people need to know how the system works in the first place.
Yeah, so those federal research dollars are so critical to our innovation and our therapeutic success. That money goes directly to laboratories like my own, and also for collaborative research. So it's really important that doctors from different disciplines can talk to each other and use funds for a common goal that really helps move the research forward. So those monies are going directly to funding the studies that lead to the innovation and the therapeutic potential. Now, there are other money too. These are the indirect costs that you mentioned. This is like the overhead or the pieces of the funding that are important to supporting our work. So, our facilities that hold our equipment, the equipment itself that we share. This is a very efficient way to do research. This is a great way to do research. So, individual labs like my own don't have to buy a big microscope that's 2 photon. We can share with other people. And it also is important for our analyses of our data and how we interpret it. in how we talk to each other. And those types of monies are currently under attack by the Trump administration. They are fighting in court to cap that overhead. Now we've been able to block that, but those types of fundings are only temporary and they're under appeal. For the research that goes directly to our labs, that amount of money that you talked about, that is so critical that we keep it at that level and don't cut it by a third. So the proposal by the Trump administration right now is that NIH dollars, including those for cancer research, are cut by a third. That would be devastating for labs like my own.
So you're saying that there's some direct costs, like the salaries for the scientists, right? Or maybe putting together clinical trials. And then there are the equipment facilities that support the important work you're doing. And when you talk about collaborative research, Dr. Bernard, are you talking about other scientists within the Michigan State University uh, system, or even collaborating with scientists from other research institutions?
Both of those are true and necessary for our success as researchers. So I do collaborate with a lot of researchers here at Michigan State because we have great expertise in environmental health. One of the things I study is risk factors that lead to cancers. But we also have collaborations outside of the university as well with
Uh-oh. We need to improve the Wi-Fi at MSU, I think, Dr. Slotkin. While Dr. Bernard gets unfrozen for a
yes.
second, her internet, I think, might be a little bit unstable. She was talking about how she works with patients who are have hard to treat breast cancers, or maybe they're drug resistant breast cancers. But part of the process is she has to write grant proposals to the NIH, right? And then wait. And writing those proposals is very, very time consuming. It takes a lot of time away from the research itself. So until we get her back, what has she told you about how challenging that is?
Yeah, I mean, we are hearing like a loud scream, collective scream from our research institutions, Michigan State, University of Michigan, Wayne State, about what this is doing to their programs across the board. I will tell you though, an example that I think you can identify with that drove it home for me, and I think drives it home for those who are kind of sort of casually interested in this topic, is, because my mom died of ovarian cancer, I do a lot of ovarian cancer events, right? It's very hard to detect. By the time you
Right.
know you have it, it's often too late. So I met a doctor who's a researcher at Johns Hopkins, and she has piloted a blood test that would tell you at stage one whether you have ovarian cancer. Just a simple blood test. It could be revolutionary for women facing ovarian cancer. And she had an NIH grant, and they stopped payment. They stopped the money because they said somehow that her project was too woke, right? It was too much focused on, it was exclusive for one group because women are the ones with
Women, that is
ovaries,
so
right?
insane.
And so she cannot continue her research right now on testing this pilot program. So something that could have dramatic effect on every woman in America, she can't move because of this frozen money. So it's just, to me, those are the stories that when you tell people, even people who are strong supporters of President Trump, when you tell them that story, you can see the kind of blood drained from their face, especially if they have a loved one who's prone to different forms of cancer. So
I
it
mean, there's
is,
so many stories like that,
yeah.
Senator. I mean, I know of a woman who has stage 4 colon cancer. She's in a clinical trial, and I haven't, she's a friend of someone I know, and she couldn't go back for her treatment because of staffing cuts, and there were not enough people to to give her, I guess, administer the chemotherapy. And when you have stage 4 colon cancer, every hour counts. And you're hearing about clinical trials being stopped in their tracks. It is just horrific for people who are dealing with cancer. Let me see if I can get Dr. Bernard back. Elissa, I'm sort of technologically challenged, you guys. So what should we do, Elissa?
We're gonna press this.
We're going to press this.
And then we gotta
Okay, then we got,
here.
okay, let's invite Dr. Bernard back. Sorry, everyone, but it's not my fault. It's Dr. Bernard's internet. Dr. Bernard, hi. Sorry, you guys, have they been cutting funds to your internet?
Yeah, I guess so. I guess my phone overheated. This isn't something I do routinely, so this is my first time with a ring light. I don't know if it's heating up my phone or what, but
Well, no problem. We're glad you're back. I was just talking to Senator Slotkin about, um, how a lot of these programs have been stopped. And by the way, I can't emphasize how as Dr. Slotkin, Senator Slotkin said, how revolutionary a blood test for ovarian cancer would be, because there is no screening. It is diagnosed often very late, and because there's no way to tell, and oftentimes by the time you're diagnosed it's too late. And we were saying how criminal it is, quite frankly, that this pilot program testing a blood test that would result in the early detection of ovarian cancer has just kind of been stopped. And I was saying, tell me about your work specifically with breast cancer, hard to treat breast cancers, maybe chemo or therapy resistant breast cancers. How have these funding cuts affected you?
so we were very fortunate to be able to secure federal research funding from 2020 to 2024. But like every good grant, you do have to get it renewed and fight to be able to continue the privilege of doing that work. And in 2025, the review process was completely stalled. So I couldn't even get my grant reviewed to continue the funding that I had previously been funded to do. And we also have new projects also that we've submitted for grants. So luckily now those grants have been reviewed, but there's two stages of the review process. The second stage is also uncertain, and that's council. And that's where the administration can make decisions based upon their budgets and their priorities. And we do not know what this current administration's priorities are going to be moving forward. So that really makes it so we don't know what to do next. We can't plan and we can't continue our work. I can't recruit new graduate students in my laboratory for the fall. These are the people that are really important for executing these studies along with the investigators. So the research has been affected right now. But I'm also very concerned with the proposed budget cuts by the Trump administration. What's going to happen in the future? Will there even be a chance for my renewal to go through or my new grants to be funded in the next couple of years?
So what will that mean for you? I mean, will you have to give up your job as a cancer researcher? Would you consider going overseas? I know France has rolled out the red carpet for a lot of cancer researchers, and we'll talk about that with Senator Slotkin in a moment about the
Mhm.
global implications. But, if it, will you try to get private funding, philanthropic funding? What will you do?
I have always tried to get private funding and philanthropic funding, but it's not the magnitude that's needed that the federal dollars give to allow you to do the life saving research. You need to have that. And it's absolutely a possibility that my lab will shut down in 5 years.
And what will you do?
So I could continue to teach, I continue to provide service for the university, but I will look at other universities as well because I'm a cancer researcher. That's what I want to do. It's not about a passion project for me. This is about saving lives. This is what I've studied for and what I've trained to do, and where I think we need to go, especially like you said in your introduction, Katie, with the advent of AI and machine learning. We're in the midst of a technological revolution, and I don't want to pause or stop. This is where we need to keep going and keep pushing forward and trying to get funding from all sources, but especially
I'm
the federal government.
I'm curious what you're hearing from your fellow scientists. Obviously, it's a close-knit community in many ways, sometimes pretty competitive too. But what are they saying to you, Dr. Bernard, about their situations? Are they as upset and beside themselves as you are?
Absolutely. So this is affecting nationwide researchers and cancer researchers and diabetes researchers and Alzheimer's researchers. And sometimes our best cancer discoveries are serendipitous and come from other fields. We're all in it together. We're all feeling it together. And there's a lot of anxiety and uncertainty about the future.
Senator Slotkin, it's hard to keep track of these cuts, but my producer, Adriana, who helped prepare me for this interview, put together some statistics. And she wrote, as of July 3rd, a website called Grant Watch, maybe this actually came from you all, which was launched to monitor these cuts, reported that almost 4,500 NIH grants were affected, totaling more than 10 billion as lost or at risk of losing funding. Um, you know, have you talked to anyone in the administration, Senator Slotkin, about why, of all things, I mean, there are many, many things that are being cut that we could discuss. Like I read today, USAID has been dismantled and they're incinerating like all this food that could have gone out to starving children that is sitting in warehouses. They've ordered it to be incinerated, which is so upsetting, but I digress. But have you talked to anyone in the administration about why they want, why they feel like these cancer research isn't that important?
Yeah, well, I think it's a couple of things. Number one, you all saw sort of the Doge effect in the first couple of months. It was just a wild, moment of a group of people who had no real understanding of what the government does, certainly on research, coming in and just cutting, right? Using AI informed software to pick out grants that literally said the word diversity or other keywords that they didn't like, and they just started putting things on hold. So that was the first couple of months, that rush. Then the president presented about a month and a half ago his proposed budget for next year, which cut research dollars by 40%. So it's both a today problem, like Dr. Bernard is describing, but it's definitely a next few years, next decade problem as well. When you go and engage the administration, first of all, finding someone who will engage on these issues and who is also informed, very hard, very, very hard. When you call the NIH or the NSF or other places that are being cut, the staff are terrified. The staff are scared to give any opinion about something, to give you information about things. Don't underestimate the role of fear right now that's going on. And I was a federal government employee for almost 17 years before I ran for office. Federal government employees are acting out of fear or not acting because of
Right.
fear. And then I think what we're seeing, if I can be frank, is certain people with access to the White House getting the loosening of funding for their pet project, right? If you're from Alabama and your research institution down at University of Alabama is screaming bloody murder, you're using your access to try and get some of that money back. And so it's really created kind of a marketplace for people's favorite projects. And if you have access to the president and his immediate staff, you can get that back, which is not, that's just not American, right? To do it that way and to do policy that way.
So are you
Um,
saying like red states are getting more money than blue states?
we're watching that very closely and who's getting exceptions, right? If Dr. Bernard says we're on hold for a bunch of grants at Michigan State, are they on hold at every other big public university in the red states? We're watching that very closely. And I certainly know that I've watched in real time, Senator Katie Britt, who's from Alabama, who I serve with, speaking loudly about cuts to research dollars to her research
Well,
institution.
University of Alabama is a great cancer
Right.
research
There.
facility, but so is MSU, so is the Hut,
Right.
so is, there are so many of them, and they're not all in red states that voted for Donald Trump.
Right. So the other piece that I have tried to engage them on comes at a different angle, and that's through national security, right? That's my background. And I just have to say that while everyone on this screen and everyone watching, we all care deeply about the research. I also want to say that for all of our cuts, a 40% cut that we're looking at for potentially next year, China is absolutely quadrupling the amount of money that they're putting into research. They know what's going on. This is their moment to grab the reins of global science leadership and take it. And just like Dr. Bernard said, you add in technology, AI, and this is an exceptional moment. But I always ask Americans, like, if the new wonder drug is developed, tested in China, do you feel comfortable with that? Do you feel comfortable ceding the newest, developments and breakthroughs to another country? I think that has real national security implications, not just on the research which we care so desperately about.
Well, can you explain that for people who may not be able to make the connection between, and that's one I'm struggling with it, with innovation and national security, like drug development, innovation, medical progress, and national security.
Yeah. So for me, it's about whether we want another country to have a veto over what we do, how we treat our patients, et cetera. So for example, let's take ovarian cancer because that's so personal to me. There are scientific researchers right now in China who are getting unbelievable amounts of money from their government, investments in their labs to research the new wonder drug for ovarian cancer. Okay. Um, they're going to research that in their labs. It's going to come up through bench science. So they're going to do, pilot testing. They're going to do all the things, hopefully, that Americans would do. And then suddenly they're going to say, we have this drug, it's safe. And if you have ovarian cancer and you're sitting in Lansing, Michigan, you should take our drug. Okay. Well, suddenly, I don't know what their research practices are. I don't know what their testing practices are. We're going to want to make sure that's safe before we advise and give that to any patient. And let's say we go through all of that. And in fact, they did find the new wonder drug for ovarian cancer. But then we get into a military argument with China, right? We have a real scratchy military situation in the South China Sea over Taiwan. And suddenly they say, we're cutting off that drug. You have ovarian cancer in the United States? Too bad. You're no longer going to get our drugs. We're going to withhold critical items from the United States as punishment for a military problem that we're having. I don't like when countries that have been adversarial with us have that power over us. So to me, not only am I worried about scientists going over to other countries, not coming to our universities, that brain drain that we're all, we want the best and brightest. I'm worried about them investing a lot in research, developing things that are important for global health, and then withholding them as punishment to the United States if they wanted to.
Understood. And Dr. Bernard, do you know many people? I know that this is more of a China national security issue, but the brain drain, as Senator Slotkin mentioned, is also of grave concern for scientific innovation in this country. Do you know many people who are saying, screw it, I'm going to go to Europe? I'm up. I think maybe we lost her again. Hold on 2 seconds. I'm going to go somewhere else here. We'll find her, you guys. I figured this out. Um, have you
I will
heard? Yeah,
I
have
will
you?
just say I have certainly, I mean, all the time, I'm hearing my brother happens to be a bench scientist, not on cancer. He's a plant scientist. They're cutting down their grants. And these young grad students, the best and brightest from around the world, are saying, well, I've gotten outreach from Austria, from Switzerland, from France. The Dutch are inviting me to be a fellow at their university. If you're passionate about your research, you're going to go with whoever is going to pay for that research. So suddenly, not only are they taking their research there, the newest development that could come out, the newest breakthrough, but they're probably making their life there, right? Maybe they're settling there, they're immigrating there and getting legal status to be there. We want to be the place that the best and brightest of the whole world comes. And right now we are definitely seeing scientists leave the United States universities and go particularly to Europe right now.
Yeah, I wanted to ask you, obviously Doge is responsible for these cuts. This quote, I hate calling this big, beautiful bill. Just the big bill. How much that also contributed to reducing cancer research dollars?
So there wasn't a line item in the big, beautiful bill on cancer research. What there was is probably what we expect to be about 17 million people who are going to lose their insurance. So separate, lose access to preventive care, which is terrible on itself. There wasn't a line item there. What we have is the president sent up to us his proposed budget for next year, which we're now starting to take up here in the Senate. And it cut research across the board by 40%. I mean, billions of dollars. So if they move forward with that, then scientists like Dr. Bernard and across the country, National Science Foundation, National Institutes of Health, Cancer Institute, I mean, it's all going to go down by 40%.
And I guess, hi again, Dr. Bernard. I guess the question is, Senator Slotkin, why? Why have they, why have they targeted science? I mean, does it go with this whole trend of doubting science, not respecting scientific expertise? Is this part of this kind of anti-science, really tragic anti-science movement that has been permeating, some of these circles?
Yeah. So I think it's a couple of things. Number one, they've got a math problem because they want to cut a bunch of programs so that they can afford their tax breaks to some of the wealthiest Americans. You just got to cut some in order to be able to give those tax breaks. So that's a first order problem. Then number one, yes, I think there are plenty of people who don't believe how and don't understand how important scientific research is for our daily lives. They have no idea that the GPS that they use on their car, or the drug that their mom's on for Alzheimer's is something that came from bench science, right? Maybe on something very different than cancer, or Alzheimer's. And then number three, as no one can be missing, that the Trump administration has really been going after our universities in general and university culture, right? And that these places are not places that they like. And therefore, we want to cut away from their federal government support to these universities. And I'm all for universities having to be more affordable. They should be open to all people. Like, those things we can agree on. But I think it's part, and parcel of their kind of anti-woke, anti-culture agenda and not understanding how science impacts our lives.
Anti-intellectualism. Kendra Norman, hi Kendra. She makes a good point. This seems to go against this whole idea of making America healthy again. If there's such a big emphasis on understanding chronic illness, how can they expect to address these issues if they're making such huge cuts?
Yeah, I think it would be a mistake to think that there's like a coherent plan going on in this administration right now, because you're right. I mean, make America healthy again. Lots of loud banging pots and pans about how we need to make America healthy. And then in the same breath, cutting research, in the same breath, allowing more dangerous chemicals to be used, in our water and in our land. So don't overthink that there's some deep, clear ideology behind this. I think part of it is just slashing budgets. Part of it is just punitive. And part of it is just one hand not talking to the other hand.
It sounds chaotic to say the least. But, one thing I wanted to talk about, and I won't keep you all for too much longer, but, you mentioned, Senator Slotkin, about this ovarian clinical trial or developing a blood test uh, that would indicate if that would screen for ovarian cancer early, and that it was considered woke because it affected women. And what's really frustrating to me, and I'm not a scientist, so I thought, Dr. Murard, you could explain, not only is access such a fundamental issue in this country, but from a scientific vantage point, it is really critically important to understand how different therapies impact different populations. And what is considered DEI is actually fundamental scientific research, because people's biologies are different. Women weren't required to be included in clinical trials until 1993. They were considered to be just like small men with breasts. But will you explain? Because I think some people don't understand. It's not DEI, it's understanding a whole, uh, a whole array. I'm sorry, I'm inarticulate because I'm getting sick, but a whole array of patient populations.
Yeah, that's extremely important to start discussing, because cancer affects everybody, and understanding the etiology or what causes those cancers might be different in different populations. Not every tumor in the breast tissue is the same from woman to woman, and how that person responds to therapy, metabolizes that drug, might be different in different people. And that's really important for us to understand so we can make some determinations on risk or progression and outcomes. And to be able to understand those differences, we can harness those for treatment. Cells grow in different ways,
Yeah, and
sometimes in different people. And so understanding those growth mechanisms and how they may be different is really important to therapeutic development.
yeah, I always think about how women of color are 40% more likely. I think that's the statistic. Sorry if I'm wrong, you guys, but more likely to die from breast cancer than Caucasian women. Part of it is they're diagnosed later because of access, but another part of it is biologically their tissue may be different. And this is some of the stuff that we don't understand that a lot of scientists really in the last 5 years, I would say, have started to focus on. And it's just so pathetic to me that this stuff is under the umbrella of DEI when it's really about basic science and making sure everyone is treated appropriately according to their own specific biologies, right?
Yep. Integrating that biology with those socioeconomic factors is really going to be important to make sure we get the best outcomes for everybody.
I know that the head of NIH said that the uh, told the staff of the agency that he remained, quote, absolutely committed to advancing the health and well-being of every population, including minority populations, LGBTQ populations, and every population. And yet, and yet, at least 172 NCI grants, including for research aimed at minimizing health disparities among racial minorities or LGBTQ people, were terminated and hadn't been reinstated as of of mid-June. So I think they're saying it, but what they're doing is something different altogether, right, Senator?
Yeah, I think the what we've seen is when something becomes unpopular, then they bob and weave and try to kind of paper over what they have done in their talking points. But we don't see a ton of change in what they actually do with the money. And as we know, like talk is cheap. So we've seen this over and over again. It is still and very important. I just have to put in a plug for people speaking out and speaking up, as Dr. Bernard is, about what they care about and what matters to their lives, their families. It public pressure does work on these folks. It just takes a kind of a constant beating of pots and pans from the public. And so we get a ton of calls into my office every single day of people telling these like very specific stories. And I can't tell you how important that is, because that is what they feel and what can actually change their behavior.
You know, I do a lot of these interviews and everyone says, call your member of Congress. And honestly, I think a lot of people are feeling that that doesn't have an impact. I talked to Debbie Wasserman Schultz about the detention center in the Everglades, and she said, it really does have an impact. But I think people are honestly getting frustrated and saying there's got to be more than calling your member of Congress. There's got to be something more that people can do who care about cancer and all medical research, by the way. It's not just cancer. Um,
So can I give you a list? Because if
yes,
this is the
please.
audience, right? So, okay, the center of gravity for changing the behavior of this administration is popular sentiment, right? These folks are populists. When people turn against something, they suddenly change their behavior. So, yes, okay, calling your member of Congress, I will say, I still believe that is effective, but also we have got to educate people who don't watch the news, who don't care, on the day to day what's going on in the federal government, who think it doesn't affect them, who aren't engaged in the conversation. So, writing an op ed to your local paper, doing interviews, doing a press conference with the organizations that you care about, especially cancer organizations, right? Just the drumbeat of information to explain to the average person and help raise the education level so that they're like, wait a minute. Like I was okay with cutting the federal government, but you're cutting cancer research? Wait, that's my mom, right? What are you talking about? That's what we're trying to do. And if you think about the most effective way that we pushed back on the Trump administration in the first administration, it was on Obamacare. He was obsessed with cutting it. That was his primary goal in his first year. And we thwarted him because the public was turned against him by that education campaign. So if you're concerned about cancer research, what is the op-ed you've done? What is the digital short you've done? What is the press conference you've done? Help bring more people into the fight. That's the way we push back on this. And I've seen it work.
It's so it can be so exhausting because there's so many things to be outraged about,
Yep.
but as a founder of Stand Up to Cancer, it's something obviously we care deeply about. And the other thing is I'm wondering, why aren't these research institutions banding together and speaking with one voice? Because I do think that just as scientific collaboration is the key, collaborating and coming together and waging a big, massive campaign of all the scientists, of all the researchers can have a big impact too. Is that happening, Dr. Bernard?
Not enough of it is. I think that's actually an excellent charge. You see a lot of these, if you call it grassroots investigators like me speaking out, but some of this stuff is above our pay grade that you're talking about. And we need some leadership in this area. And we need to see these universities all banding together to stand up to fight these hugely unpopular cuts to science. They're hugely unpopular, not just among scientists, among all of Americans.
I think you shouldn't underestimate the role that fear is playing, that
Mhm.
in exactly what Dr. Bernard is saying. Like, the scientists all feel it. The scientists know it because it's affecting their labs. The university leaders know it too. But there's this dance of like, but if we stick our neck out, are we going to get targeted and cut even more? Right. I have no doubt that university leadership across the state of Michigan would say, to Dr. Bernard's point, I'm trying to save the dollars that I have for people like you to still do your research. And so I'm worried about, saying something that pisses people off in the
Right.
administration. And so don't underestimate the way fear right now is guiding our universities, research institutions, our private sector folks. I mean, companies. It is. So what I'm asking of people, and I've asked, for research institutions to come together with your biggest partners. And I'm not asking you to pick a fight. I'm not asking you to just slam Donald Trump all day long. I'm asking you to call balls and strikes on what these cuts are doing to your mission. That's it. You don't have to be nasty. You just have to be factual because the facts speak for themselves. We got to help our scientist community speak to more average Americans. Sometimes scientists, not Dr. Bernard, but sometimes
Mhm.
scientists um, believe that we should just all embrace science for the good of the nation. You got to explain it to people who don't do science, why it's important for their lives. But explaining it as a group is so much more powerful. And just like fear is contagious, so is courage. So is standing up. And when one does it, it's a lot easier for others to join. So this has been I would say, constant back and forth for my 6 months in as a senator with leaders in my state that don't pick a fight. Be really clear about your mission because it will speak for itself.
And I know we're out of time, but before I go, Senator Slotkin, what are we going to do? It's so depressing. It's such a mess. So many of our institutions are being irreparably damaged. Uh, you know, the America that we're witnessing unfold is just not the America I think the majority of people want to see. I think people want to see humanity and compassion and, yes, good governance and, smart use of money and a realignment in some cases of priorities. But what's happening is so upsetting. And do you think, like, what is the answer? Is it waiting till the midterms so things will change? And can we last that long?
No. So I will just say a couple things. First of all, number one, you don't give up the ship, right? We all love this country. We want it to be better. It's like our country right now, with the way we're so polarized, we are ill. We're like an ill loved one. And what do you do when your loved one gets sick? You do whatever you can to help it come out and come through that illness. And that's what we need to do as a country. Now, you can't do everything, and it is exhausting. We all know people who have just turned off, right? Who aren't
Right.
watching today because they're like, I can't handle it. What I'm asking people to do is go deep on one issue. Don't peanut butter spread yourself over 2,500 different issues. You can't. Pick one, like if it's cancer research or whatever. I would offer that we don't have the right to give up. I am sitting here in the US Senate. I'm the youngest Democratic woman in the Senate. If women had given up fighting for women's rights for 100 years, I would not be here, right? So we can't give up. And cancer research and the things we're here talking about today, there are proposed additional cuts that we can still beat back. So if this is your issue, go deep, write an op-ed, put something online, start the
Talk to your
conversation.
friends, talk to your Facebook group, right?
Just
Get
be a
people
little brave.
galvanized.
Be a little brave to say things like, look, I just learned this fact and I can't sit by silently because my loved one has cancer and this is too personal. But find one thing and go deep on it. Do not give up the ship because we don't have the right and our country needs us right now. They do.
Well, thank you so much, you guys, but you ladies. I always say you guys, either way. Elissa Slotkin, Senator from Michigan, and Dr. Jamie Bernard. Dr. Bernard, as just personally, thank you for what you do. I think cancer researchers and really all medical researchers, my life has been so impacted by cancer personally. So I've gotten to know a lot of scientists, and I have endless, boundless respect for what you do and what people like you do. You don't get a lot of acclaim or attention, and you work day in and day out trying to save lives. And I can't think of really a more noble profession. So thank you, thank you so much. And I'm sorry, you guys. I better go drink some tea because I sound like Brenda Vaccaro, and you guys are probably too young to even know who she is. But anyway, thank you for your time and thank you for inspiring us to get involved, Senator, and go deep.
You bet.
Thanks,
It's my
Katie. Thanks
privilege.
for what you
Okay.
do.
Okay. See you all. Bye.